The 3 stages of stroke recovery: acute, subacute, and chronic. What's happening in each of them? And what should you be doing in each to maximize your recovery? Let's find out. But before we jump in, make sure you support the channel however you can. Like this video, subscribe, click the join button to become a channel member, or leave us a super thanks by clicking in the YouTube bar below. Now, if you have watched my 7 Brunnstom stages of stroke recovery video and wondering, what's the difference here? The Brunnstom stages refer more specifically to changes in muscle tone and motor function or movement after a stroke. The 3 stages I'll cover today apply more broadly to stroke recovery based on how far out you are from your stroke, and they're not limited to just motor function and movement. Feel free to skip ahead to whatever stage that you're in. But with that said, let's jump into stage 1, the acute stage. The time frame here is around the first 7 days after your stroke. And what is actually happening in this stage? So you've probably been admitted to an acute care hospital. Likely doctors have ordered some type of neuroimaging, a CT scan, or an MRI to look at your brain and see what's actually going on. Doctors will want to understand what type of stroke you had, ischemic versus hemorrhagic, so one caused by a clot or a blockage, or one caused by a hemorrhage. They'll want to know where in the brain the stroke is occurring, and they'll also want to know how severe it is, also that can guide their treatment. The goal in the acute phase is simply to get someone medically stable. Doctors may be able to do this with medications alone, but sometimes neurosurgery is required. Doctors will decide the appropriate treatment based on your specific situation. During this initial period, when you're in the acute care hospital, you may or may not receive rehab therapies. It depends on the severity of your situation. They will likely come in to do some type of evaluation and assessment to see how things are going and determine in conjunction with your doctors if it's appropriate to start rehab therapies. After you've been medically stabilized, your stroke care team should be talking with you and your family about what next level of care is appropriate for your situation. For some people, that looks like being transferred to an inpatient rehabilitation facility, to a skilled nursing facility with a rehabilitation department. While for others, you may be ready to discharge home with home health therapy or outpatient therapy. And unfortunately, in some circumstances, people are discharged home without any therapy at all. So what should you be doing? You need to be focusing on resting, eating, stabilizing, and if it's appropriate and you've been approved, engaging in therapy. And lastly, advocate for going somewhere where you will get as much therapy as you can if your stroke care unit team thinks that you can tolerate it. And this brings us to stage 2, subacute. This is typically defined as the first 6 months. And what is happening during this time period? Well, a lot. You may have been transferred to a different facility for continued rehabilitation, or you may have been discharged back home with or without a referral to therapy. Now, during the subacute stage, you may or may not be able to return to work or driving, and you may notice that you need more help for things that you didn't need help for before your stroke. So that's what's happening in the physical space. What is happening in your brain during this time? Well, your brain has essentially gone into overdrive. You've entered this state of spontaneous hyperactive neuroplasticity. And if neuroplasticity, that phrase, is new to you, it just means our brain's ability to adapt, reorganize, and create new pathways. What's interesting is our brains are capable of making these changes throughout our lifetime. But after a brain injury like a stroke, the brain enters that heightened state of neuroplasticity where it's making those connections and reorganizing at a much faster rate. So understanding that, what should you be doing during the subacute stage? Capitalize on that heightened state of neuroplasticity. Use it to your advantage. This is when you are going to see the fastest amount of recovery. So pragmatically, what does this look like in practice? It means that if you are in therapy at any point during this time period, that first 6 months, you give therapy your all. Listen to your therapists. Ask them for home exercise programs or home activity programs that you can do outside of therapy, or if you are still in a rehab hospital, that you can do while you're in your hospital room, either by yourself safely or with a loved one. If you are getting ready to be discharged from therapy during this time period, ask your therapist for some graded home exercise programs and activity programs that you can do at home after you're discharged that will help you make progress over time. And if you're not in therapy, you don't have anyone to guide you, please go check out all of my playlists. I have upper body workouts, lower body workouts, workouts to help you get arm movements started, those that address secondary stroke prevention. This will give you some ideas of where to start, and then you can always talk to your doctor to make sure that they're appropriate for you. But whether you get a program from your therapist or you get some ideas from me, make a home rehab program, schedule it, and stick to it. And then in addition to a structured program, just simply use your affected abilities as much as you can, as long as you're safe to do so. This means that when you're taking a shower, when you're getting dressed, making the bed, making yourself a sandwich, you are using, say, your affected arm if you've got one-sided weakness as much as you safely can. This is going to help you avoid something called learned non-use, which is quite literally when we learn to not use abilities because oftentimes it's simply easier and quicker to just use the unaffected side. But it's also important to recognize that during this time, you may also need to learn some adaptive strategies or use some adaptive equipment so that you can be as independent as possible. This doesn't mean that you stop trying to improve your affected abilities, but if you go home and you need to be independent in certain things and maybe using certain pieces of equipment is the only way to get you there, then that's absolutely fine. You have to do what you have to do to maintain as much independence as you can. You also want to ask your doctor about what caused your stroke. If you're able to find out that information, this is really important because it's going to help guide what you need to do to prevent a secondary stroke. Understand if you need to control your stress levels. Do you need to get more sleep? Do you need to make sure that you're taking medications to control some of those underlying factors that may have contributed to your stroke? This is a really important piece of the puzzle that you don't need to forget about. And lastly, in addition to working on movement, gaining back your independence in things, working to prevent another stroke, you need to watch out for mental health and mood changes, personality changes, issues with sensation that can sometimes cause safety issues, an increase in muscle tone or spasticity, an increase in fatigue or pain, and changes in cognition that affect your ability to think and reason. If any of these start to develop or a loved one tells you they've noticed something different about you, go ahead, schedule an appointment with your doctor and just talk with them about it. Talk with them about what you're experiencing because only then can you get the appropriate treatment that you need. And this brings us to stage 3, chronic. Time frame here is anytime 6 months after your stroke and beyond. What's happening in this stage? You have likely been discharged from formal therapy and you have hopefully returned to life. It might be a new normal and a new routine. I know some people hate that phrase, but life has likely changed to how it was before your stroke. You may be experiencing the stages of grief, mood, and mental health changes. All of these feelings are extremely normal. I just want you to know that. And for others, you may not be dealing with those issues at all, whether you're just early on or you're years out. So what's happening in your brain after that first 6 months? You're starting to see that spontaneous, heightened state of neuroplasticity start to slow down. So this doesn't mean that in terms of stroke recovery, you're stuck with whatever level of progress you made at 6 months, 1 year, etc. It just means that it's probably not going to happen as fast as it did in that first 6 months. So understanding that, what should you be doing during the chronic stage of recovery? Whether you are 6 months out from your stroke or 5 years out, continue to work on your affected abilities, whether it's mobility, balance, coordination, strength, perception, sensation, fatigue, cognition, or mood. If you are looking for guidance on these specific issues, I've made videos, I've made workouts covering all of those topics. I'm gonna leave links down in the description below. Hopefully this will help to give you a starting point, and then you can check with your doctor to make sure that they're appropriate for your situation. But you wanna continue to dedicate yourself to your home rehab program, because we know now that there is no time limit to stroke recovery. So if you stop, your progress will also stop. And if you put in the effort, you will make progress. But the hard thing is that no one can do it for you. And while it's easier to do it under a therapist's guidance, if you don't have access to therapy, it doesn't mean that you can't keep getting better. Also recognize that it might not happen at the pace that you want. You might experience backslides and plateaus, and this is completely normal. But that doesn't mean that that's where your progress stops. You are your biggest advocate and ally. The healthcare systems that we have in place unfortunately don't support neurological recovery the way that they should. Now, we can be upset about it, but we can also do something about it. So regardless of whether you are 1 year out from your stroke or 20 years out from your stroke, progress is always possible. Learn what you can, educate yourself, talk to your doctor, and keep moving. Leave me a comment and let me know, what stage of recovery are you in and what has been most helpful for your progress. As always, a huge thank you to all of the donors who make our nonprofit possible, with a special thanks to Heather G, Ryan D, and Modus Nova in our Empower tier on Patreon. Thank you all so much for watching. I'll see you next time.